Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today's show, we have Crystal Beal. They are a family physician, and their KevinMD article is titled "A Doctor for LGBTQ plus Health Needs." Crystal, welcome to the show.
Thank you so much for having me, Kevin. I'm really glad to be here.
So we'll get into your article in a little bit. First off, just briefly share your story and journey to where you are today.
For sure. I think like so many physicians growing up, I kind of had a vague notion of just wanting to help people with my career. And fast forward to being in college, and I almost had finished actually a degree in food and nutrition science around dietetics work, and looked at kind of job opportunities that would be available to me once I finished that degree, and thought, this just really isn't what I want to do. And I think if I don't try to go to medical school 40 years from now, I'll look back and wonder, could I have done it? Would it have worked out? What would have happened? And so I spent a few extra years in undergrad and got my prerequisites in, and then went to Florida State University College of Medicine, which was a lovely place and a great fit for me personally. And then did family medicine residency out in Washington State at Valley, and ended up staying in the Seattle area after residency to practice, because it's a beautiful part of the country, certainly.
Yeah, so tell us a little bit about your practice.
So my practice, I actually started my own practice back in 2018, and it was fully telemedicine based before that was cool. So that was pre-COVID times, and everyone kind of wondered, how are you going to have a clinic that's just online? But I had gotten to work with Kaiser doing both their prep care clinic and some trans healthcare there, and really saw how all of Kaiser's prep work is done through actually phone visits, not even video visits. And so I really got to see how when you have a narrow scope of practice, that can work really well through virtual care, particularly, in the Kaiser system, they're already established with a PCP, so they're getting, their greater healthcare needs met that way. So I thought, I'm pretty sure I can open a practice that focuses on LGBTQ health through video visit platform, and it will actually serve the needs of the community better by increasing access to care. So many LGBTQ people who don't live in a major metropolitan area don't have access to specialized providers or providers who are part of the community and have lived experience. And so my thought process was telemedicine would kind of change that experience for my community. In addition, for me as a millennial medical school graduate with a ton of student loan debt, it would allow me to open a practice without kind of the financial burden of paying for a space, a physical space, which is really a huge barrier in small private practices these days.
So let's talk about your KevinMD article titled "A Doctor for LGBTQ plus Health Needs." You open up your article, quote, "As a queer, non-binary, poly, and kinky person, medicine has been a challenging field to fit into, both as a patient and a physician." Now, before you talk about that article, talk about some of the challenges that you faced.
Right. I think any marginalized group can kind of have some similarities in that context of medicine is a very white, hetero, cis normative, kind of male-dominated field, although obviously more females have been getting into medical school than males over the past, I want to say like 10 to 15 years, right? I feel like when I went to med school, we were right at that 50-50 margin, and I think since we've kind of flipped over. However, the field definitely has that dominant culture, and it really has those undertones of a professional field, which I feel like a lot of our concepts of professionalism really come out of like colonialism and white supremacy. And for people who don't have those same values and don't live in that culture, it's just kind of a culture clash every day that requires a lot of code switching to fit in or to get places professionally. So specifically, I think I just ran into not having mentors that looked like me, or faculty that looked like me, or shared my life experience. I very frequently was like too outspoken and just, not what people expect. I can't tell you how many times I would walk into a patient room and say, my patients would say, "You don't look like I thought my doctor would look," right? And my response depending on the patient, obviously. The patients I knew better over time, I would say something kind of like, well, I'm never going to be a middle-aged white man, so we'll move on. Obviously, patients I don't know, you don't necessarily say things like that too. And I do think, one of the comments on the article was about how, as physicians, the experience of healthcare shouldn't be about us, right? And I don't disagree with that statement. I get asked when I present to medical students and healthcare provider students of all kinds, because I'm so openly out online in my identities, they're often like, we talk about self-disclosure to patients and whether or not it's appropriate and when it's appropriate. And I always frame it for them. I do not sit in a patient visit and talk about my identity. I share it openly online so that patients are able to see it and know a little bit about me before they come see me, because we do have some research, not in queer communities, in communities of color, that show patients actually get higher quality healthcare when they see people with a shared identity. And so I give them the opportunity to have that choice and know a little bit about me up front, which every major healthcare system does. Like every Swedish, Kaiser, all of the big systems put profiles of their physicians up and share a little bit about them. So I don't think there's anything wrong with that. But I'm not sitting in a patient encounter telling them my stories or talking about myself, because absolutely right, that's not what a patient is there for at all.
So go more into your article, A Doctor for LGBTQ plus Health Needs. For those who didn't get a chance to read it, just summarize it for my audience.
Right. I just talked about kind of my experience as a queer person going through both the healthcare system as a patient and as a medical learner and a physician. And really, I just had a lot of negative experiences as a patient. In particular, that was a big motivation for me to open up my own practice. So many of my physician encounters, like my physicians just, I've had the story I shared about being misdiagnosed with an STI was like maybe the worst case of discriminatory care I experienced. And I literally got lectured by my provider about my lifestyle choices, which was a monogamous relationship with a female.
So tell us about that interaction when that clinician lectured you. What was that like? And then you were sitting there listening to this, and what were you thinking?
I was in my first year of medical school, so I think maybe 25 or 26. And I think I was in shock the whole time. I had never had an experience with a physician where they took me to their office instead of an exam room. So just that contextual change was so confusing to me as a young adult who had like very little experience navigating the world or the healthcare system. And it really changes the power dynamic too, right? Here's this person with authority who has the information I need about my body and the treatment I need for my body, sitting behind a desk where all of their degrees are on the wall, all of their accomplishments are behind them, and they're really in charge of that situation and that narrative. And it just felt kind of like being in the principal's office, maybe, like I was in trouble for something that was literally just me dating someone I loved. So it was, now, like knowing what I know about healthcare now and knowing about like the kind of care I try to provide for my patients, it's kind of appalling. Also, the diagnostic missteps there were really, really bad, which we won't go into the details, but like what I had was like a very obvious casebook or textbook case of something that like, I can't believe he misdiagnosed. And then to just have him never even acknowledge the fact that he had made a mistake, that I had gotten like unnecessary treatment that was ineffective. And also to like really never know, if I hadn't asked him why I wasn't getting better, if he would have ever addressed that issue for me. And then I got the pleasure of being his student in my fourth year of medical school. So I got to rotate back through his practice as a learner, and I found out later on he's like a Seventh-day Adventist and rather conservative person, which made the story make more sense.
So tell me some of the unique challenges that the LGBTQ population face in the exam room.
A lot of the research shows that, a quarter of all LGBTQ patients will have experienced an episode of discrimination seeking healthcare within the past year. Over 50% of trans people will have a story in the past year of healthcare discrimination as well. And unfortunately, we know any discriminatory experience increases someone's likelihood of delaying seeking care, which every provider knows delayed care causes poorer health outcomes. Couple that with the minority stress, that causes like increased rates of cardiovascular disease and depression and anxiety, and substance use disorders in our community. And we just see overall poor health outcomes. And so I think it's getting better in a lot of places, but it starts before patients even come into this space. So like people's social media, people's websites, their waiting rooms, like when they don't reflect kind of affirming and inclusive imagery and language for all marginalized groups, like we already can't see ourselves there, and we're already not sure if you're going to be a safe provider that we can actually talk to you about our concerns, right? And so things like diverse imagery of LGBTQ people, of people of color, people with disabilities, people of different communities is so important on social media and websites and artwork on the wall and educational patient handout materials in the office. And then like in the forums, like making sure they include, all sexual orientations and identities, right? I remember being in med school and the big affirming question for like sexual healthcare screening was like, do you sleep with men, women, or both? And that was like a big move away from, are you married? Which is like the very common question in the South where I grew up and where I trained, right? And our medical school was like so proud of themselves for taking that step, right? And it is like language evolves and care evolves, but that's still falling short of so many people, right? Because none of the people I'm in partnership with or, have romantic or sexual relationships with identify as men or women. And so you're just leaving out such a huge swath of the population. And so I think just even being visible is a huge step and a huge problem that LGBTQ people face in seeking healthcare. And then having not just like a kind provider, but a knowledgeable provider. Sure. And a big part of my mission in starting my practice was really to change the experience of care, particularly for my trans community. Often the bar for a trans or gender diverse patient seeing their provider is that their provider will just use the appropriate name and pronouns for that patient. They don't expect that provider to actually know how to manage any of their healthcare needs. So many trans and gender diverse patients like go to their doctor's office with like printed out, like, this is how to take care of me. I found this for you. And I just think in no other healthcare condition that I provided care for as a primary care physician was that the model of care, my patient telling me how to manage their healthcare, right? I definitely had patients bring in like they saw a drug on a commercial or they heard about this weird thing that they thought they might have and they would bring me some information about it. And no, I wasn't familiar with it. But never did I say, let me take the information you give me and decide right here, right now. I said, I don't know very much about this. Give me a couple of weeks. I'm going to do some research and maybe reach out to some specialists and we'll make an appointment 2 weeks from now and I'll have more information to help support your care. And so I just think that so often one of the ways to approach people is like with curiosity, but like, I don't actually think that's appropriate. I think with kindness, with inclusivity, but like it's our job as providers to either go and get the information we need to take care of people or to have a really good referral resource that we've already vetted where we can send people on. I couldn't do a joint injection to save my life in primary care. So I had a colleague who was great at them. And that is where I sent people when that was what they needed, right? Sure. And he sent me every IUD and Nexplanon that he saw. So we make relationships with our colleagues who have the skills we don't for a reason.
Now, what are some resources that you could recommend, perhaps educational resources or resources online that clinicians can turn to?
Oh my gosh, so many amazing resources. I will, of course, do a self-promotional plug. I have an online platform called queercme.com, which is all CE/CME certified content for providers who are interested in improving their gender affirming or transgender healthcare offerings. And we release new content every month where we do live content and you can ask questions. So that's a really great resource. That is a paid subscription, although the live events are free for all. The National LGBTQIA+ Health Education Center is a completely free resource, also CE/CME certified. You just have to create an online account and then you have access to hundreds of hours of free CE/CME on all kinds of LGBTQ healthcare topics. It's a phenomenal resource. And then those are kind of both online, asynchronous. There's some great conferences out there as well. And so really WPATH is obviously one of the major organizations in trans healthcare, but the PTWC is a really great conference as well. I'm involved in organizing that one, the Philadelphia Trans Wellness Conference. And then I think Harvard and Fenway usually co-host a transgender affirming healthcare conference maybe every other year. That is also really a phenomenal conference as well. Highly recommend all of those resources. And then another really great online resources is Transline Zendesk. So if you're taking care of trans or gender diverse patients and really have like a question you can't answer, they have a free e-consult option, which is phenomenal. So you just fill out the form, send in your question, and you get a response within a couple of days. So phenomenal resource. Similarly, Seattle Children's Hospital has an adolescent gender clinic, and you can do a phone consult to their providers and you'll get a response within 24 hours. Your patient does not have to be in Washington. So amazing free resources for supportive care.
We're on to Crystal Beal, who is a family physician. Their KevinMD article is titled "A Doctor for LGBTQ Plus Health Needs." Crystal, short of doing all that CME and going to all that conferences, so if a primary care physician like myself sees a gender diverse or queer patient, what are some of the most impactful things that we can do to help facilitate that interaction?
Yeah, I think first off, like how you introduce yourself to your patients is like step one. So anytime I introduce myself to a new patient, I say I'm Dr. Beal, Dr. Crystal, or Crystal. Any of those are fine. I use they, them pronouns. What would you like me to call you? So off the bat, I'm giving some of the information and the knowledge that like I'm aware that we don't all go by our legal names and that like pronouns matter. And I'm not going to assume your pronoun based on your presentation. So that automatically sets a tone of affirming an inclusive environment. Mm-hmm. I also give patients the option to use my title. So many people have been traumatized and harmed by physicians, and that word can actually be triggering. Some physicians have really strong feelings about being addressed as a doctor, and I definitely understand. I worked in addiction medicine quite a bit as well, and unfortunately, I saw a lot of physicians. I mean, I got my job because the physician at the facility prior to me sexually harassed patients. So I think giving patients the option so they can avoid trauma triggers is really important. And then if you have trans patients who want healthcare and you're not sure how to do it, and it doesn't fit into like the time and energy you have in your office or clinical setting, just having a really good vetted resource where you can send them, I think is super, super important. Like not everyone has to prescribe testosterone or estrogen for trans or gender diverse patients, but they need to be able to send someone to those resources. And I think from a primary care perspective, you do want to know like primary and preventative healthcare needs. And so definitely there is like a 1-hour webinar on the National LGBTQ Health Education Center on preventative care for the gender diverse population, right? Which is a phenomenal resource for primary care providers. And it'll help you like think about when so many of our preventive care screenings are sex-based. It will help you make decisions about when do I do screenings on cholesterol or bone mineral density or breast cancer in someone who's endogenous hormonal milieu and then exogenous hormonal milieu have like shifted through the years. And so I think that's a lecture worth sitting through.
And my final question, any take-home messages that you want to leave for the KevinMD audience?
Yeah, I think I never found like more joy and fulfillment in my work than I did when I started, really showing up as my authentic self. And I think I got the message so many years from medicine that my authentic self really wasn't welcome or wanted. And for me, it did involve creating my own practice in my own space, but it's been a world of difference for me in the context of burnout and the joy I get from my career. I think until I started this practice and worked within my own community, I really questioned my decision to go to medical school. I really, really thought if I could do this over again, there's no way I would have given up this much of my life and this much of my money to do this thing that makes me feel small and unvalued. So I think that would be my biggest message to any provider out there is there is a space for you here in medicine and in healthcare, and we need diverse voices because our patients are diverse voices.
Crystal, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Thanks for having me.